So, Dr. Quraishi, what you are saying, these kinds of these form of heart conditions, they may sound awful, they may sound very frightening, but you can treat them.
Sure.
You can treat them, and you can cure something some way. But what happens when a child develops something like that later on, and especially as you are talking about the incident of high cholesterol in children?
Right. That's a very good question. Again, it depends on the type of disease they have. If it's a small holes which was not picked up earlier on during his childhood days, then usually they don't cause much problems. But if they are significant holes and if they are having symptoms, the most common symptoms which you can normally have when somebody has heart disease is chest pains, shortness of breath, difficulty breathing, limitation in physical activity. They most commonly complain, I can't climb up the stairs in the school. And sometimes they have lightheadedness, they pass out, they have palpitations. These are some of the common symptoms which we normally come across when you have heart disease. It's more or less the same as what you tend to have in adult population, and it's nothing different in terms of presentation. So if it's a small hole, if it's a small tube like PDAs and stuff like that, those are not much of a problem. You can take care of them later on in life also without much damage to the baby's heart. So especially for atrial septal defect, which is the hole in the upper chambers of the heart between the two receiving chambers, usually they don't cause much problem until the third or fourth decade of life. So those are very well tolerated diseases. Sometimes they are found incidentally in adults. For some of the reason they go for appendectomy or appendix operation, and they find, oh, you have a hole in your heart. So that depends on the type of disease. As far as your question about high cholesterol level, it's a very interesting question. Most of the people, they don't even think that this disease can exist among children. As a matter of fact, it does. And what we call as atherosclerosis, it's a process where there is deposition of cholesterol within the major arteries, starts very early on. It starts in childhood. And there are different stages of atherosclerosis. I just brought some pictures which might be useful to our viewers.
तब तक आप दिखाते हैं, हम एक बार फिर अपने दर्शकों को बता दें कि हम बात कर रहे हैं आपके बच्चे की सेहत की. अगर आप कुछ बात पूछना चाहते हैं, खास तौर से हार्ट से जुड़ी कोई बात बारे में कोई प्रश्न है, तो हमें कॉल करिए. डॉक्टर कुरैशी आपके फ़ोन के जवाब देंगे. जी.
Sure. So I just want to show some pictures here which I brought which might be very useful. This is the normal artery. As you can see here, the arrow points towards the flow of blood within that tube, and this is the cross section. Here you can see this is the opening. This is the opening inside, and if you compare that to the diagram below, this is the deposition of fat, and this is the opening. Initially you start off with a larger opening, and as you see, where the deposition of the cholesterol is, the tube becomes narrow, and this is how normally this is the size you normally have. If you compare that to this, it's almost half of that or even less. So these are some of the major problems what you can have when you have high cholesterol levels. Now if you imagine this happening in a small vessel, in a small artery like this, which are called the coronary arteries, which are the most important vessels which supply the heart muscles itself, this is what causes major problems. And that's when we call coronary artery disease, which is referred to as coronary artery syndrome, or also these are the what we call as heart attacks in late term.
So my question again is that you mentioned the word heart attack, which is again very frightening thing.
Right.
And in children, what is the rate of getting heart attack, and does it because of the cholesterol or जन्म से जो उनके साथ होता है, that's a different issue.
Right.
But developing cholesterol, narrowing of the arteries, and suppose a child looks very healthy, and all of a sudden you read so many incidents where the child just dropped dead because of the exercise or the sports or anything.
Sure.
So, you know, what do you do? I have not read about the children in general getting heart attack.
Sure.
Just for my curiosity, tell us, you know, how prevalent this rate is, especially in our community.
Sure.
because
absolutely.
I think we, as a mother, South Asian mother, we are very fond of feeding our children.
Right, absolutely.
Have some more, have some
Sure.
more. You have not eaten, and I think that's where the problem starts, probably.
Absolutely. That's a very important question you asked again. The commonest complaints we have among children is chest pain. And if you see the statistics, the number of children visiting the pediatric emergency room in any hospital, the number one cause for pediatric ER visits is chest pain. Although the complaint is very common, luckily the causes of chest pain related to cardiac reasons are less than 3%. So having said that, in those 3% of the category, there are few heart conditions which can be very fatal if they have one. And some of them are called as cardiomyopathies, which are enlargement of the heart. Normally you see a nice thin walled walls of the heart. Now if these become thick or enlarged or dilated, those are called cardiomyopathies. So once they develop cardiomyopathies, that's a very severe disease to have. Those are progressive diseases, and if it's not diagnosed in timely fashion, then these children are the ones who are very prone to die suddenly without any premonitory symptoms or without any symptoms presenting earlier on. They are very healthy looking kids, and all of a sudden they're playing a baseball game or basketball or a football. All of a sudden they just collapse and die. So this is one of the diseases which can present that way. There are other diseases also which is called anomalous coronary artery origins. Normally the heart muscles itself are supplied by this red colored tubes which are called coronary arteries. These are the tubes which arise from the aorta itself, which supply the heart muscles itself. We have two coronary arteries. One is called the left main coronary, coming off from the left side, and one is the right coronary, which comes off from the right side of the aorta. So the left coronary artery again divides into left anterior descending, and this is your left circumflex. So what happens is, normally these are the two buttons. I don't know if you can see from here. This is the aorta, which is the main artery which carries the oxygenated blood from the pumping chamber. So the first branches which come up from the aorta are the coronary itself. So the blood supply to the heart muscles comes off from the small buttons here, which are branches from the aorta itself. So instead of the left coronary coming off from the left side of the aorta, if they take its origin from the right side, or say from the pulmonary artery, then the heart muscles are not getting enough oxygenated blood. More so when the oxygen demand is more, which normally happens when you're exercising, when your demand is more. So in those situations, again, these children can present with sudden death. The most important thing is sometimes what happens is when it's taking that course, it runs between these two great arteries, the pulmonary artery and the aorta. So when you're exercising, what happens is these two tubes, they dilate. So once they dilate, the small tube which supplies the heart muscle gets compressed between those two tubes, and the blood supply to the heart muscle is stopped. So those are some of the severe form of heart diseases which can present as sudden death.